Kenya, poverty is a reality that affects many, but it disproportionately affects women and children. They are marginalized, vulnerable, and unable to access the healthcare they need. Join us on a journey to witness the resilience, hope, and optimism of women and children in Mutomo, Kitui County, Kenya, and how they have not only overcome the challenges that have hindered their health and well-being, but also made impactful contributions to the journey of Cmmmb's mission. We work with women, beneficiaries, professionals, volunteers, healthcare workers, and policymakers to create lasting health and economic empowerment solutions. Faith Katete is a 40-year-old mother of 10 and a farmer of Kathiaka village. She rears goats and grows maize and millet on her small farm. 9 of her 10 children were delivered at home. Her 9th child, a son, was her first child to be delivered in a health facility. She named her son after the doctor who delivered him at the Kalambani dispensary.
Narutomedi matjijibi narua koja muti tikoteyo tuomwe ni walioga taigilini chira le jogara erutomedi yarua koja muti nitawa tajini tuomwe wedite mondo magwegwe mwe na kuma madukara to muti na yagana enama.
Kangaroo Mother Care is giving baby patients who was born too soon and too little a fighting chance. Bridget Musenya, 21 years, was looking forward to delivering her baby, but her joy quickly turned into panic and anxiety. Her daughter, Patience, was born too little and too soon. She weighed 1.4 kilograms below the minimum acceptable weight.
Nilipompata niliambiwa nifanye kangaroo na nilimpatia katika senda ya kwetu. Nikakuja hapa, daktari wangu yule akanielimisha kuhusu kangaroo mother care. Sikuwa najua vizuri, nilikuwa namfungia hapa, namweka nguo na namfungia hapa. Akareduce to 1.1. Nilifanya bidii tena, akaendelea kuongeza mpaka akafika 1.8. Kangaroo mother care imesaidia mtoto wangu, anapata warmth nikimwekelea hapa juu ya ile bond. Alafu amekuwa hapati magonjwa na inasaidia sana kureduce kukaa hospitali sana. Yes, imenifurahisha sana. Ingekuwa si kangaroo mother care, singekuwa na huyu mtoto. Yes.
We received the baby as a referral from Kanziko Health Center, which happens to be a level 3 facility. And the reason for the referral, it was prematurity and low birth weight. And the birth weight for patients was 1.4 kilograms. So when we received the baby, we started essential care for that baby, and we initiated them on kangaroo mother care.
When she worked at Mutomo Mission Hospital in Kitui County as a nurse, Veronica Madheka, 63 years, did not give as much attention to cancer. This is because cancer, regardless of the type, was not only associated with witchcraft in the region, but was rare.
I was diagnosed with cervix cancer 2014. I was bleeding
So I decided to have a VIR check. I was checked. It was suspicious. I was sent to St. Mary's for biopsy.
She was shocked when in 2014, doctors diagnosed her with cervical cancer at stage 2. Shortly after, she marked her 18th anniversary of being a nurse at the Mission Hospital.
Most of the people are stigmatized because of the cancer. They are not coming out to speak out, or they don't want people to know that they have cancer.
Medication is very expensive if there's nobody who is to support them. And at the end of the day, you find them staying at home and not going to the hospital. And if they do, they go very late when they cannot be helped.
So with palliative care, they are able to voice out their sickness. They can talk to each other. And so with palliative care, they are able to live another day.
As a survivor, I would advise those who are eligible for the vaccine to go to be vaccinated.
In Kitui South, a key set of frontline professionals are helping the community take care of themselves. Community health volunteers. The community health volunteers, also known as CHVs, give mothers basic information on family nutrition and sanitation, danger signs in pregnancy, and how to keep children healthy. Zipporah Mbwese was mending clothes at her small tailoring shop in Mwangeni Market in 2013 when the Kitui County government came scouting for community health volunteers.
Before hiyo kuwa community volunteer, mimi nilikuwa fundi wa chalani, nilikuwa na shona. Lakini nilipoanza na hiyo Cmmb, ikakuwa siwezi kushikilia sana kushona, lakini nafanya kulima. Ni wakati ule yenye siko kwa field na ninalima.
The 39-year-old mother of one gladly joined a handful of locals tasked with promoting public health by bridging the gap between the community and hospitals.
Mimi kama community volunteer, kazi yangu ile nafanya ni kuangalia watoto wa chini ya miaka 5 kama wako na nutrition nzuri, kama wana lishe nzuri, na kuangalia kama wako na chanjo ile inafaa, na kama wana ninawarifa kwa facility level, na kuangalia wamama wajawazito kama wanafanya hizo clinics zote, na kama wanakula lishe nzuri, na kuangalia kwa community wakunywe maji mzuri, wakuwe na choo, na wakuwe na wanao mikono kila wakati.
One thing about community health workers is to reduce the maternal deaths. And also, as you are aware that most of the mothers in case because of far and ignorant, they don't want to come to the clinic, they are not aware that what it means also to come and deliver in the hospital. So with this, the monitoring, they help in reduction of some of the mental illnesses, which you get them through during postnatal, perinatal or antenatal. So these community health workers, normally they have very good interventions where we are able to be helped as a hospital, as a ministry.
For a long time, hospital visits by pregnant women, young children, the sick, and the elderly meant uneven services as basic equipment, essential medicines, and clean water were lacking. But this has since changed. Sister Mary Okumu, a sister of Mercy and the administrator of Our Lady of Lourdes Mutomo Hospital, has seen a gradual shift in service delivery following the support of various partners in the facility established in 1964, which serves a remote, poor, rural community.
The support from Cmmb comes in handy because even by just renovating that unit, it's telling you we want to make lives better. By enabling mothers to come to the hospitals for delivery, it's telling you we want a healthy mother to have a healthy baby. So as the administrator, for me, I think I'm very happy because mothers and babies be a very key of population, then their health is very, very important. Last week there was a training, I think 2 from this hospital, a nurse and a clinical officer were trained on care of newborns. So hopefully Cmmb are going to help us equip the unit, and hopefully we should be able to manage ourselves here, all categories of babies that need care.
But poor health is one of the concerns for women and their children in Mutomo. The Angel Investor Program seeks to fight the vicious cycle of poverty.
Mbeza cia mradi ciugaa kila mwini ngwatangili kenda na nithire ngika maundu makwa ya mbeza cia mbe natumiwe miili nombanya nowe ngoi ya 12,000 na mananana. Mbeza cia keli no ya ciana makondolo na mebe school fees ibinde zitu liu nukwona miondondo ili oitika kuwa liu no cio nuwa liu nacio no cio ngumita ciana school uniform baingwa no yongua aya pala no saa ciendu o utukali nini gidio kwekara gidi kweba na tumiwa mwana wakwa na musiye tene na muradi ukisa utwika no ambosi ya mwana inena thina ogwi ukithetha mwana athia akota kibalua no ndikomena nta nondu mwana ndito kuma kibalua ni nake lakini la musa wokie na mbosi ya mwana yambe na yake ile ambete kabila na tungia ngai wako mubea nundu oyibe ingwa banu ndathi nake anaketa ni wawa na ilo musukuma ngamoro aba hospitali.
Dr. Winnie Kitetu, County Minister for Health, the highest-ranking official in the health ministry in the county, is tasked with not only policy execution but ensuring the health of the county residents, including mothers and their children. A leader known for her compassion, empathy and deep commitment, guided by her previous experience as a pharmacist and clinical psychologist, but above all, as a mother dedicated to her family.
Then other ways which we have survived in Kitui County and the Ministry of Health, it is through our partners. Partners have really come handy to support us in the programs which we have, and because of that now we have been able to manage to run. Otherwise it would have been a challenge.